Thanks very much, everyone. We're going to move on to our second panel discussion of the afternoon. And that's going to be from Children's Health Queensland. And they're really going to talk to us again about, I guess, implementing or bringing to life consumer engagement, particularly in a paediatric setting, and the unique challenges and opportunities that come with that. I know they're going to be very enthusiastic. And I've got a lot to share with this. Just a reminder that we are going to try and keep very much to time because we've got to go to our formal session at 4:30. So without ado, thank you very much, Nicola. Welcome to you and your team, and we look forward to hearing from you.
Thank you. And thank you all for joining us for the last session of the day. Thank you to Health Consumers Queensland for the opportunity to be here. We're really excited to be amongst people who share our passion for consumer engagement and co-design. Before we get started, I'd like to acknowledge the traditional custodians of the land that we're meeting together today, the Gubbi Gubbi people, and pay our respects to elders past, present and emerging, and also respects to any First Nations people in the room with us. My name is Nicola. I work for an organisation called Children's Health Queensland. You may be familiar with our home base hospital, Queensland Children's Hospital, which is located in South Brisbane. We are a statewide paediatric hospital and health service, so we provide clinical care to children right across the state for lots of different things, from either Queensland Children's Hospital or one of our community clinics or hubs, as well as increasingly virtually. We run a number of statewide services and always looking for creative ways to connect with children and young people who are accessing our services right across the state. In addition to our clinical work, we are also really active in the research space, as well as advocacy and policy. All things related to children's health and wellbeing, we like to be involved. We have a really strong focus on person-centred care at Children's Health Queensland, as well as equity, and thinking about health and wellbeing much more holistically than just delivering the clinical care that children and young people need when they come through our doors. So that's a little bit of a background on who we are in the system. Today we're joined by Belle Taylor, Jeremy and Jess, and I'm going to ask them to introduce themselves before we get going for the session.
Thanks, Nicola. Good afternoon, everyone. My name's Belle Taylor. So I'm a member of the executive at Children's Health Queensland and thrilled to be here with you today. At CHQ, engagement is represented twice at the executive table. So my portfolio looks at the broader stakeholder engagement, from consumers to our broader network of partners, our public engagement through our websites, and from a cultural perspective with our staff engagement and more broadly. So unfortunately, I couldn't be joined here today by my clinical executive colleague, Tanya Hobson, who is the executive lead for consumer engagement at CHQ. Unfortunately, she is unwell, but passes on her best wishes to everybody here. But really thrilled to come and share with you this project that we're working on.
Hi, I'm actually not from CHQ. My name is Jeremy Kerr, and I'm a design lecturer at Queensland University of Technology, QUT. And what we're working on at the moment is a co-design framework, the collaboration that we're doing. It's with QUT and with CHQ in our early stages and a really exciting sort of journey ahead of us. My background is in co-design methods. So I teach in the School of Design, but I also do a lot of research in different contexts with co-design. So I've worked with Bravehearts, with Autism CRC, with Kerr International in Papua New Guinea, and I've worked in India with some organisations as well. So I kind of just pop up on really diverse projects. I don't really have a specialisation in the health industry as such. It's more about bringing co-design and collaboration methods in a designerly way of problem solving, which is what we're exploring in this project.
Hi, so I'm Jessica Cheers, and I'm also at the design end of this spectrum. So I'm coming from QUT. I an experience designer, which I know is a bit of a nebulous term, but it basically means that I spend my career designing both co-design experiences and what the actual experience of going through a co-design process should look like, but also the outcomes of that process and what healthcare experiences are going to look like for consumers, and how we can engage them in designing those actual experiences. So it's as much about designing the process as it is about designing the outcomes. So that's the kind of work that I do. And over the last few years, I've been sitting mainly in the healthcare space and really going deep into co-design. I'm sort of halfway through my PhD, looking at how we can use more playful and exploratory and creative co-design methods and how we can adapt those to different healthcare contexts. So I'm really interested specifically in working with children. I, over the last year, have been working on a project with the rheumatology team at the Children's Hospital, looking at how we can redesign the first 100 days of juvenile arthritis, using a lot of playful and creative co-design methods. And I also did a year-long fellowship with Clinical Excellence Queensland, kind of figuring out what the place is for a designer in healthcare, and exploring all of those opportunities. So I'm coming into this now at more of a strategy level, but over the last few years, I've been working mainly on practically applying co-design and understanding all the barriers and the opportunities around that. Yeah, that's me.
Aren't we all so lucky to have such expertise in the room? So we're going to start by hearing from some of our panelists, and then I'm going to try to leave about 10 minutes at the end. So you've got 20 minutes to think of all of your questions, hopefully something related to the topic we're here to talk about. The others can wait for the event at the end. So Belle, we're going to kick off with you. Can you offer us a little bit of background on the context that CHQ is working in terms of consumer engagement and co-design, particularly with children and young people?
Absolutely. So to give the briefest context I can to the last 8 to 10 year journey that CHQ has been on, I think it's fair to say that engagement, partnership, co-design is embedded in how we do things. And Jess has just shared some of the fun things that we're trying within our health service. And that really began at the genesis of the HHS. So we've been on a significant journey where we went looking for an evidence-based framework that we could build this on. We found Planetree International. And for those of you who haven't heard of Planetree, global healthcare leader that really champion an evidence-based approach to person-centered care. So, you know, in our halls, consumer engagement is a critical central element of person-centered care for us, but actually we look at it in a much more broader ecosystem that involves our clinicians, that involves our community, and of course involves our patients. So we are quite unique, I think, in the system in that our consumer engagement is often in its majority form with parents and carers as opposed to the patients themselves. And there's many reasons for that. I think parents and carers are the fiercest advocates for their child and young person, and nobody knows that child or young person like their parent or carer. And I think that we have built and continue to build a really strong foundation of that provides so much value to us as a HHS. And I need to call out 3 of our fierce advocates that are in the room, Kirsty, Nolene and Fiona, who have been with us for a long time. And I think that, you know, we're on a journey together in how we continue to improve that, but a really strong foundation that we've built. And we went on a 5-year journey with Planetree to achieve gold certification, which we received in 2021 in terms of the way we centralise person-centred care across everything that we do. And we were the first, not only the first hospital in the country to achieve that, but the first paediatric healthcare provider in the Southern Hemisphere, which we were incredibly proud of. And like I said, I think it's built a really strong foundation, but now we're ready to reimagine what is next. And in doing that, we really reflected on how do we amplify the voice of the child and young person directly in this work that we do. And I think, you know, Jess just touched on that can be quite challenging when you are dealing with minors. for a whole variety of reasons that are extremely valid. But what we wanted to explore, and that's what this project really is how do we meaningfully, sensitively, and authentically amplify the voice of children and young people in the way we do things. And that is, we went looking for a critical friend because that's not something we wanted to enter into blindly. And we've got a great relationship with QUT and probably 12 months of conversations with Jeremy. And we realised the value alignment was there, and here we are today exploring this concept.
Thanks, Belle. You've kind of answered my next question, but when we're thinking about, I guess, reimagining consumer engagement and co-design, particularly the amplification of the voice of children and young people, healthcare loves a good strategy, don't we? We love the strategies, we love the frameworks, we love seeing on paper what it is that we're going to do. So as an executive, I know that that's part of your job, maybe not your favourite part, to do the writing down part, but when we're thinking about, looking ahead in this space and developing a new strategy or action plan for the organisation in this space, where did you start? What were your musings on how to do this differently and creatively in a way that keeps the focus on the impact rather than the document?
Great question. And I think, we're at a point in terms of the paper written down, we are at a point where we are ready to redesign our consumer engagement strategy. And that is sitting with Tanya Hobson, who I mentioned and is my colleague. And I was reflecting on, from a strategic perspective, what value could we add? What kind of creative thinking could we provide to that really important piece of work, so that as we go on that journey of what that strategy will look like, we can think a little differently. And as Nicola said, the writing down of things on paper is not my favourite. I actually love the doing and the experiencing and the trialling. And so what we kind of talked about was a lot of what we do and we want to capture in what we're going to take forward is happening in pockets of our organisation already. How do we create that more consistently? How do we build capability in terms of the pieces of excellence that are occurring across our organisation to create more consistency in that? And how about we just give it a go? So I really wanted to take an action learning approach to this. We could have spent 6 months on a really great journey of writing things down and getting in a room and ideating and putting things on post-its and engaging with our partners on what could be. Or maybe we could just trial something on projects that are live, that are critically important and for some of our most vulnerable children and young people that we see in our service, with the steady hand of our academic friends along the way. So I very much wanted to take an action learning approach to this piece of work, with a view that it will inform our more formal strategic pieces going forward.
Thanks, Belle. You've mentioned there the steady hand of our research colleagues is so important here. When we're trying something new, particularly in that creative, innovative space at CHQ, which we love doing. I love that you picked up with this was going to be enthusiastic from the start. We're a children's hospital. We're interested in doing things differently. Imagination is one of our core 4 values. To do that safely, we need academic rigour and good method that underpins us. So great to have our friends at QUT not only in the room with us, but on this journey. Jeremy, interested in your reflections when a very practical hands-on organisation like Children's Health Queensland is considering bringing in that rigour that academia can offer and research can offer into engagement, co-design work with children and young people. Where do we start in terms of theory and research?
Yeah, I think the interesting thing is there's a lot of projects that have been done on co-design, but it's actually, and I've been in a really lucky position in that one of the research projects I've been working on for the last 1.5 years with Jess has really focused on co-design methods. and looking at scoping what's happening with co-design across the world in terms of grey literature, in terms of, you know, theories and so forth. And there is still this level of ambiguity and mystery around co-design. Like, we have a lot of papers publishing in these processes, but we still don't really understand what are the dynamics of it. How do we create this experience, which is just, you know, really about collaboration? And it's not just about collaborating, it's about connecting someone's lived experience and that expertise that they have in an area with the fact that intrinsically everyone is creative and can solve so many problems in their everyday life. But we as co-designers, we're often about facilitating an environment that takes the pressure off the consumer in the room, feeling that they've got to solve everything, and making it a playful, fun, capacity building process for them. That's certainly the ethos that we take into our work. Not necessarily every co-designer is so strong about this idea of play and capacity building and making people grow. And I think one of the things that I'm really interested in terms of theoretical frameworks that connect with the co-design work we're doing is even the concept of citizen science with kids, which essentially that means having young people go out and be researchers, learn about research. And what we've found with a lot of you know, the studies in that field is that it's more likely that those young people will then go on to university or go on to further learning. So it actually works on multiple levels. So there is certainly an ethos of being trauma informed as well, because we're dealing with young people and they're vulnerable. So I've actually developed, this is where I've, you know, been in a really lucky position in developing some methods throughout these very different projects I've been on, which are using personas and characters rather than having the consumer reflect directly on their own lived experience. So they can also reflect on the experience of their peers. And so it becomes a storytelling narrative experience, which is about solving problems rather than reflecting over things that aren't necessarily great. And this is so important with young people. And I guess even, you know, I've found that I'm increasingly being quite open about the fact that as a young child, I went through trauma and I had chronic PTSD. So I'm not just coming from this as a researcher who is testing methods. I actually understand why these methods work, and they worked for me in terms of dealing with things as a young child. So it's been interesting that we're able to develop original methods. And I guess one thing to also talk about is this idea of action research with what we're doing. We're not jumping in and creating these documents. We are actually looking at how can we capacity build people, the staff of CHQ, so they can design their own co-design methods. They can experience design consultations with young people. So they love and they really want to participate and contribute, and they get a lot out of it. So it's about a growth and a cultural change as well, and a different realizing that you as a health professional can also be kind of a designer in your own way as well. So that's been interesting that we're embedded in a couple of projects. At the moment, I'm working on an eating disorders sort of service redesign project with young people with a lived experience of eating disorders. We're also involved with a community hub with young school children, which will involve counsellors and doctors within schools. So it's been really wonderful in that we're not jumping in and developing a framework straight away. We're understanding the culture, how things happen, the nature of people, what their understanding of co-design and consumer collaboration is, to just kind of really have a deep understanding before we jump into anything. So it's been it's a fantastic opportunity as an academic. I've been very lucky, and most of my projects are very practical and based in the real world, but certainly having, this type of collaboration where we can kind of explore and have time to think and reflect and have working parties that are going to involve diverse groups is kind of a best case scenario for me. And I think that's why we wanted to share it, because it's a beginning of a journey, but we know it's a pretty special journey.
So it's possible to bring research and practice together live in active work. Jeremy, that was really, really helpful. And thanks for giving us a bit of a sense of what some of these projects are that are bubbling away. Jess, I know you've had such great experience across different parts of our health system in terms of the practicalities of actually designing within the system. Have you got any advice on how an organisation, whether it be an HHS or another organisation within the health sector, go about applying this sort of research and theory that Jeremy's mentioned in practice, and any key learnings that you have for people in the room?
The annoying and beautiful thing about co-design is that it's a bit of a mess, and it sort of needs to be a bit of a mess. If there's anything I've learned over the last couple of years, it's that you can't go in with a bunch of, frameworks and toolkits and step-by-step guides. That's not really going to work. You need something bigger than that. That's a culture that kind of allows for exploration and creativity and adaptability in projects like these. I think the co-design projects I've been a part of that I've seen have the biggest impact, and I feel like they really had a genuine, meaningful impact and built, a community through the practice of going through the project. It was really because we had the space to be experimental and adaptive. If we tried one method and we felt like it wasn't working, we were able to adapt. And that can be hard to do. And as we're learning, going through these case studies, there are barriers that kind of prevent you from being able to be that experimental. And I think it'll be brilliant to be able to create a strategy that affords that and kind of helps people to design methods that are actually appropriate for their projects and people. In my work with the rheumatologist at the Children's Hospital, it's very stressful for health professionals when you try and come in as the designer and you're like, oh, we're going to experiment. It's going to be great. The rheumatologist, Beck, who I was working with, I think I gave her many heart attacks over the last year, just trying things. And she would be in such a state of panic. She was like, am I going to lose my job? But it's so worthwhile. And because we had the space to do that, we were quite lucky. We've been able to use some really interesting methods. And when it comes to engaging with children, I think that sometimes the classic approach to co-design that is like, here's workshop 1, workshop 2, and workshop 3. And, we're going to run these workshops, and then these are going to be the outcomes, and it'll all be nice and tidy. It doesn't really work necessarily. And I think it's about those moments in between the workshops. And it's also about, how can we do things that might not be so acute? You don't have to, get a bunch of people in a room and do specific activities. Like Jeremy was saying, things like citizen science. We sent home some little, what we call probe packages to a family, which had a bunch of tools that they could use to document their experience. So we're trying to redesign the first 100 days of juvenile arthritis. And so we wanted to actually see what that looks like in the moment in practice. So we found a brilliant family who are thankfully willing to take us through their 100 days. We managed to get onto them, a couple of days into that at their first appointment when they were diagnosed. And I quite rapidly made this package for them that was, we had an initial interview with them and we figured out, how do they already sort of document their experiences? Do they have diaries? Like, do they have a calendar? How are they keeping track of what's happening here? And how can I design something around that? So it was incredibly bespoke. It was just me, in my living room making this sort of package for them that had calendars, diaries. We had some little disposable cameras for the kids. And a bunch of activities that they could go to at important milestones to capture what was happening in the moment. And there are methods like this that, it's a little complex to put something like that together. You might need a designer, but there are aspects of it that health professionals can do. And making that a bit more accessible and showing how some of these other methods can be adapted to different contexts and giving real examples of that, I think is what really excites me in co-design and the kind of work that I love to do. But this whole idea of co-design is very much the space that Jeremy and I sort of tango in at the moment. And I just think it's so important to actually co-design the whole co-design process. I think it's the perfect way to go about it.
Yeah, just on that point, can I just sort of say, one of the interesting things is if we look at consumer engagement along a lot of the streams, and I know that there's a lot of tension about this, but often some key decisions, and we've heard it just here with the prior panel, decisions are made before the consumers come in, or we know what we're going to build, even though we're going to let you make all the decisions on what we're going to build. But you're not going a step further and going, we have money, what are your needs? And so even when we have some projects that are emerging in this sort of space that we're exploring at the moment, where there is a sense of what is needed, and the research even shows, independent research, quantitative research shows, what is required. We still, when we engage young people, we take it a step earlier, and we might validate that what is expected that they might need is, that's what they identify and prioritize, but we have an open mind, and we look at how that might be different. and how we might have a preconceived idea that, and it's not pure sort of consumer engagement. So that's a really important part, and this idea of designing the process to ensure that that happens, I think.
And also, I mean, on the topic of the previous panel, that's also, I think, a really important stage in building trust. Having them in that process from the outset and always presenting, you know, consumers' own ideas and experiences back to them, and finding ways to do that that build those relationships. And I think it is, yeah, when you have these bespoke methods that you really designed around people, they feel it, and they feel like they're a meaningful part of the process, and it creates those relationships inherently, which is really important.
Totally. And we know that every family is different, and every child and young person's experience is different. So there's something here, isn't there, about bespoke design for every consumer that we need to engage with. But at a strategy level, creating enough of a framework that allows our organisation and all of the people who work within it to be able to tap into the capabilities and the skills they might need to create that bespoke experience. So there's a bit of a tension here coming through, that on a really practical level, we're looking for that very person-centred bespoke approach, but at an organisational level, we're still looking for guiding principles and strategies and a sense of direction, and both are required. And so we're hoping through this approach of action learning, we're sort of able to tap into both ends of the continuum together and meet in the middle. I've stuck right to my promise, and I've given you 10 minutes for questions. Have we got anyone in the room with questions for this amazing panel? Hello. Do we have a up the front here? Oh, we'll come to you next.
Is it me? Oh, Maya. Hi. Hey. Oh, I'll stand up because I can't say hi. I'm Rachel Foreman. I'm on the board of Health Consumers Queensland. My question was going to be, I work for a primary health network. We do a lot of co-design, but we outsource it. It's very expensive. And so I guess my question was, how do we make it accessible to more organisations to enable it to happen without having to rely as heavily on the limited consultants that are out there with the expertise?
The project that I've been working on for the last year and a half is actually responding to that need. So this was connected with the Woolworths Centre for Childhood Nutrition Research, and we started out by looking at capacity building all the researchers that were within the centre, because they wanted to have a co-design element, and they want the centre to be child-led. So I've been embedded in a lot of projects. They're teaching people co-design, but my own personal project with the centre, which Jess and I are working on, is creating a platform which is open source, so people can learn not through templates that tell you exactly run your workshop like this, but how to design for co-design. And this is kind of the space that we're really exploring, and we're publishing on it at the moment, because we understand that there's a huge need for this. I'm actually going to be involved in a new unit at QUT next year, which is called Design for Health Innovation. And that is about teaching designer skills in this context for health professionals, as well as people that might be in education, because there's a demand, and it's connecting design thinking with consumer engagement. And so it is expensive, and that's why we built this platform, because at the university, we have so many great groups come along, and I've done a lot of pro bono work. But it's at this point where you just have to say no, and you don't want to say no. And so that's what this platform we're designing is really responding to that need. And that's the ethos behind this project as well.
It absolutely is, Jeremy, and thank you for the question. That was the one question I predicted would come up, because but I think working in healthcare, that is the question. You know, we as a health system, we are funded for the activity of that we provide to the people walking through the door. This can be really difficult, and even in an organisation like ours, where it is, you know, part of our DNA to co-design and to engage and to want to have the child and the family at the centre of everything we do, that's not funded. So a lot of it is discretionary. And I think that was the big question from a organisational strategic perspective we asked is, We can never have, extraordinary academics like these at the elbow of all of our health services across our HHS to co-design on everything we want to do. So how do we build scale? Without giving away any state secrets, this piece of work that we are doing is actually a sprint. I don't want you to think of it as, the traditional consultant contracts that you're talking about, where you bring them through the door and the cost is large and the time is large. This really came about from, we have a really great relationship with QUT. We do a lot of work together. We partner in research. And as I said, we were probably chatting with Jeremy for 12 months before the opportunity came. We had a little bit of money that came up, and it really was not a lot. I can't stress that enough. We had a couple of projects that needed this input, and it was like, here's an opportunity for us to build capability so that, no, we will never have at the elbow support for all of our projects. But imagine if we could create the environment for, our clinicians in particular, who I think the point was made earlier by the nurse on the panel, just want to get it done and want to get it solved, genuinely want to engage, but actually can see it as a barrier to getting it done. What if we could build capability that would make it easy for them to engage in that? And this really is a permission to play. We're just giving this a go and seeing where it lands, but that's certainly one of the challenges we're trying to break down.
Hello. Oh, hello. My main question was, what age range do you guys consider as a young person? And also, do you have young people coming to you to be engaged with as a consumer, or is it mainly you guys seeking young people to engage with?
I think in terms of participants' age, a kid is a kid at any age. Obviously, it helps if the child can talk. I've worked with neurodiverse kids who are, in a lot of contexts for place-based design and so forth. I've got a PhD student who's been working in that area as well. And we've been engaging 4-year-olds and so forth. It's about designing an experience where they can contribute in meaningful ways. And some of the work that we've done with, at a high school recently for this community hub project, the most amazing conversations, and we had a mixed high school group, and some of the most amazing insights were with the year 7 and 8s. So creative, so wonderful, some of the ideas that came from it. Same with the high schoolers, year 12, but the idea is that everyone's creative, everyone is an expert, even a 3-year-old is an expert in what a 3-year-old does. And their perspective, it's all these voices that never get heard. There's so much richness there. And that's really, I think our role is always to get out of the way and just create an environment that allows their voice to connect and be heard. So I don't see any restriction to it, but this is all part of our process as we go through in the context, but certainly the selection process is based around perhaps an area, and we might look at who are the people that are the experts in that area, and it's probably someone who's gone through a certain situation in the health service.
I think we're just about on time. Room for one more, says the chair. Is there any online? No. Okay. Well, thank you. Thank you all for sharing this space with us while we share our experiences on this journey. Thank you, Belle, Jeremy and Jess. You've all been really generous with your reflections. As you can see, this is a work in progress for us. And I dare say will be forever. I don't think this is one of those things that we ever properly land, but maybe the awareness of that is actually the important part. So we'll be around if you have any questions or you want to keep in touch with us to hear how this goes. Jeremy will be taking registrations for his new course at the door. Please do chat to Jeremy and Jess about their work with this toolkit, because you may actually find it's a resource that you want to tap into over time. Thank you so much for having us.